Hello again, and welcome to this week's CLEI Center for Keratoconus video blog. I know that after our session a couple of weeks ago, I promised you more discussion on the cross-linking procedure, but I thought that for a change of pace, today we'd take a quick look at some new research in which we're involved and are very excited about. We call this CTAK, which stands for Corneal Tissue Addition for Keratoconus. This is a brand new technique which we use to improve the corneal thickness and contours in KC patients. As we all know, keratoconus is something in which the cornea thins, and because of its thinning and weakening, distorts its optics and gives poor vision. What we are doing in CTAG is placing additional corneal tissue directly into the keratoconic cornea. The hope is that this will allow subsequent treatments in patients, such as cross-linking and potentially other procedures to improve vision that are really not available for KC patients who have thinner corneas. This is being done under a clinical trial. For those of you who are interested, look up clinicaltrials.gov and place this NCT number, and we'll give you some information regarding the study. CTAK uses preserved corneal tissue. So this is human corneal tissue, yes, but it's obtained and processed under very controlled conditions by the eye bank. The eye bank inspects the tissue, processes the tissue, and specially prepares the tissue to preserve it over long periods of time. These pictures are microscopic pictures. On the left, you see a regular living cornea. The top cells are the epithelial cells, and the arrows are pointing to what are called keratocytes, which are cells within the cornea itself. The preserved tissue doesn't contain these cells. Rather, these tissues contain normal cornea and corneal collagen, which can then be used to replace tissue within the keratoconic cornea. What we do is to first take these preserved corneal tissues and with what's called a femtosecond laser make a small lens from that tissue. You can see the laser working on the left here and the ring of tissue on the right. We then take this and shape the optics of this lens under what's called an excimer laser to prepare it for implantation. As a patient, the first step is to have a corneal pocket prepared in your cornea, which uses a femtosecond laser. This is much like the first step of LASIK and preparing a LASIK flap. The CTAG tissue is then placed within the corneal pocket, as you see at the bottom of the picture here. So let's take a look at a procedure. This patient has already had the pocket made, and we are preparing it with microsurgical instruments. You're awake for the procedure but comfortable using numbing drops and mild sedatives. Here we're preparing the pocket. If you look at the ring of blue, that's the area where we want to place the tissue to improve the corneal thickness. The pocket here is almost completely exposed, and we will now take the tissue lenticule which we prepared and place it within the pocket. It slides right in, and we try to get it well centered. Right afterwards, you can see the tissue lens in good position. So let's look at a few pictures of some treatments that have been done in this clinical trial. On the upper left, we see the patient that we just saw in the movie, and this is right after the procedure. You can see the implant in place. 1 month later, it is virtually invisible and has been incorporated into the cornea. Down below are magnifications of the tissue area, and where we can see how the tissue smooths over time. And to the right is a clinical picture showing the tissue in place within the keratoconic cornea. Here's another patient, again, immediately after the procedure on the upper left. You can see a much clearer 1 month afterwards, and below and to the right, clinical pictures showing the lens in good position. And finally, here's a patient who had a larger CTAK inlay. Before, you can see on the left the apex of the cornea is very thin, and afterwards you can see the inlay in place with thickening of the cornea. Down below are corneal topographies that are taken afterwards and before. The before pictures in the center, and you see the redness, which shows a very steep cone, and afterwards on the left you can see that the corneal smoothness and shape have been much improved. On the right side is what we call a difference map, and this shows the change that's been made with the CTAK application. Keep in mind, these are research studies. They are very early studies, and we are currently working to further refine the procedure, both from the point of view of preparing just the right lenticle for a given case and for the proper surgery that needs to be done to make this smooth, safe, and with good results. So once again, thank you for tuning in this week, and we'll return next week back to cross-linking to discuss just how is the cross-linking procedure done. Until next week, I thank you for joining us.